We were going to present our long-term data of the open-label study for patients with Lennox-Gastaut syndrome at the annual meeting. And unfortunately, obviously, we couldn't do that in person, but I think it's still very important information that we have to share as it relates to the open-label study. We now have data going up to 170 weeks for patients that were in the open-label trial. So these are patients who had Lennox-Gastaut syndrome. They were participating in the randomized double-blind placebo-controlled trial and then went into the open label. And we've been able to follow them both from an efficacy and safety standpoint. And the biggest things that we were able to see as far as our results go was we didn't learn about any new adverse events or side effects that were seen in these patients. And the efficacy as it relates to both the primary and secondary endpoints of drop seizures and all seizures did not decrease. So it was maintained at the same high level that was seen during the pivotal trials all the way up through 170 weeks. So the important take-home messages for folks are efficacy can still remain for patients on Epidiolex or Cannabidiol for Lennox-Gastaut syndrome, and the side effect profiles are very similar without any new ones propping up later on in treatment. I think the important thing that the data tells us about safety and efficacy is maintained throughout the course of being on Cannabidiol, and the side effect profile was also very similar to what was seen in the pivotal trials. So most patients will have some sort of adverse event, which is seen in all epilepsy medication trials, but the more common ones as it relates to this medicine were the same, with diarrhea being number one, and that was seen in over 20% of the patients. And then as far as efficacy goes specifically for primary endpoints, you were still able to have a decrease from median seizures in the 40s to 60% range, which is very significant.